I didn't have this place, I don't know where I would be. It's life-changing. It's life-saving.
And honestly, without their help, I probably wouldn't have got most of the things done in my life. I'd probably still be stuck.
Without this place, a lot of people would be dead, for sure.
I get treated like a human being. When I come through the door, hi, Derek. How you doing today?
No, just I'm grateful for everything that's offered here. It's definitely touched my life. So I'll always take the road that leads me right here, as long as I need it.
I owe all of it to this place as far as getting me back on track.
I think the nurses and the doctors, all the way down to the cleaners here, they're the heroes. They save your life. They don't look down at you like you're a piece of garbage or something, just because you're homeless and you're down and out.
If you come and work with us for a while, you'll find, very surprisingly, most of it is really, each day is kind of full of fun and joy and laughter, despite the fact that we're taking care of some pretty tragic things. I would say we can sustain it because that atmosphere created by these really amazing, talented clinicians and support staff, is just fabulous. And then we're blessed because we're connected to the hospitals where we're embraced as part of Boston Medical Center and part of Mass General. And then we're embraced as part of the shelters. So we get to be, involved in our community. And I like to think of it as we're involved in the healthcare system, right from the ICU all the way to under the bridges here.
The healthcare for the homeless model is brilliant. The ability to be able to embed a full medical clinic inside a shelter where people who are experiencing homelessness come every day. So at St. Francis House, people walk in the front door and they're able to get all their needs met, including that most important healthcare need. We believe that life can be better for our guests. And when we come together, St. Francis House, the guest, healthcare for the homeless, we can absolutely put somebody on a healthier and better pathway.
When you partner with an organization, you want to find people that are like-minded. And what we love about Boston Healthcare for the Homeless is they approach the work with families experiencing homelessness the way we do. And that starts with building trusting relationships and treating people with respect. And that's what brings our two organizations together so well.
A lot of our folks are dealing with mental illness, substance use. Some of them aren't dealing with those things. They're just dealing with homelessness, which is traumatic in itself. And having some people treat you like a human and not see your circumstances is really important.
One of the biggest life lessons that I've learned through working here at Healthcare for the Homeless program for the past decade has been how similar our patients are to us. I think a lot of people think that there's them and then there's us. And our patients, many of them are as highly educated as we are or came from very similar backgrounds as we did. And because of life's circumstances fell into homelessness. It's the difference between having a job with really good health insurance and working as a contractor and owning your own business and then finding out that the tumor you have is cancer, right? And you don't have enough money to pay those bills. And suddenly you had to sell your truck and then you've sold your landscaping equipment and then that still wasn't enough. And now maybe the cancer's been removed, but you really can't walk the same as you used to. There's no way to recoup all of that. Plus the medications they've put you on for your back have made you absolutely addicted to taking pain medications in general.
I always put myself in the patient's shoe, so when I'm leaving at the end of my day and I step out there, it's cold, and I say to myself, how do they do it being out here in this cold?
Often people who experience homeless don't have any control over where they can sleep, where they eat, where they're gonna get a shower. And being able to build that for people and journey with them to get to those goals is such a rewarding experience for us.
Our patients know that we will always be here, and that we are one of the very few, if not the only constant in their lives sometimes, that will be here when you get out of jail, when you relapse, when you get out of the hospital, and we'll also be here when you can celebrate the higher notes of your life, when you know, have been sober for 3 months and you finally called your mom back.
Seeing the extraordinary resilience and incredible spirits that these individuals still have is really what moves me most and what keeps me going.
I know I have to do this again tomorrow and again the next day. You have to have that mindset that our patients are very resilient in all the things they have to go through.
We never give up. I mean, it is just fundamental to who we are and what we do, that we have to be in that fight.
I think it's so important to treat every single person that we meet as though they could be our mother, our father, our sister or brother, because they are. They are.
The one thing that I really learned was how to radically love. If you can give someone radical love and make them feel valued and worthy, then they will find that value in themselves.
For me, with Boston Healthcare for the Homeless, I never would have made it, you know. And since I've gotten here, I've gotten better, I've gotten wiser, I've gotten stronger, and I care about people, man.
What do these people have out there? What do they have? Us.